Next, we have Ryan Fischer, the Chief Operating Officer at FAST, who's going to be talking to us about the updates and the experiences that we've had as a community with policy. The title of his talk is Hope in Action, Updates on Advocacy Efforts. Ryan Fischer.
Thank you, everybody. I actually want to embarrass a coworker and shout out Laura Fagliano, who has been behind the scenes for everything and has been making this meeting run so smoothly. So please give her a round of applause. She doesn't love compliments, so just give her a nod or a salute, and that'll be sufficient. So I'm delighted to be here to report on our advocacy efforts, highlight results from last year, and I want to thank our collaborative partners, ASF, in these efforts, and Amanda Moore. We've been working in concert on all of this. On this multi-pronged approach to advocacy. So ultimately, we're here to recruit you. We need you, your perspectives, your insight, your preferences for treatments, your lived experience is what drives our advocacy efforts, period. We can't do this without you. And in truth, you became an advocate the day of diagnosis. We want to harness those skills that you already have towards advancing legislation and policy and really improving the lives of all patients through advocacy efforts. And with the progress we've seen to date and what you're hearing about, it really did, push for the need for a streamlined, focused advocacy strategy with Congress and regulators and those at the state level. Because in truth, in all of these areas, there are decision makers who don't understand AS. And we need to educate them and inform them. They have the power to make decisions that can really impact you and your loved ones. If they don't understand what matters to you most, they're making uninformed decisions. So that's why we set out to have such a focused advocacy strategy. And we've been coming up with ways for the community to get involved. So hopefully you all will get involved. For those who have been involved, we thank you, but there's a lot of work still to do. And this has to be both AS-focused and rare disease-focused. We have to do these things at the same time because there's policy and legislation that affects all rare disease, but we also have to focus in, of course, on Angelman syndrome and how those decision makers understand this. So let's start with Congress, everybody's favorite body. Our strategy is pretty straightforward in terms of our goals, and we want to create relationships with members of Congress. We want to turn them into champions for Angelman syndrome. We want them carrying the mantle. We want to increase the federal focus and funding on Angelman syndrome at the federal level, and ultimately support lead legislation related to improving rare disease drug development and improving services and support for caregivers and disability policy. And that's why we need to be in Washington every year. And I know it's been tough with the partisanship in Washington, but Angelman syndrome is not partisan. So our advocacy efforts won't cause you to unfriend your friends on Facebook. That's the good news. We have to go there looking for support on both sides of the aisle because this is not something that is partisan, and that's what we've been doing and set out to do. So we had our first Hill Day, March 6, 2024. Really was an incredible event. For those who have attended, if you haven't attended before, speak to those people and they can tell you about that experience. We had 65 advocates from 23 states. And we're really looking at the agencies that touch Angelman syndrome, how we can impact them through advocacy. And we looked at some of the sort of more obvious targets in our first year out, and this essential need for federal focus and investment when it comes to those agencies. They were the NIH, they're the primary funder of biomedical research and the largest funder of biomedical research. We want to ensure the investment that the NIH is making is invested appropriately. And we need to continue building on the investment and the partnership. You've heard a lot of talks that relate to NIH investment to date. So we talked to our members of Congress who essentially fund those agencies, and we want Congress to say, we've heard from our constituents, and this is what they're telling us about how you should be focusing on Angelman syndrome. The other target, obvious reasons, is the FDA. And we need them to understand Angelman syndrome, the unmet need, and your priorities for treatments. We want to ensure they're up to date on this evolving regulatory science that Allison was talking about. And then a more unknown target would be the Department of Defense. They have a program that I'm going to talk about in more detail, which utilizes tax dollars to fund medical research. And they have a track record, and in my past life in Duchenne, they funded a lot of Duchenne research. And we want Angelman syndrome to be an eligible condition. They have a list of eligible conditions that is very short. So advocates make the case of why there's opportunity to really put funding towards this program at the Department of Defense. So just a little sort of government 101, how do we fund the government? Well, hopefully Americans that you pay your taxes, but those tax dollars include a whole array of areas that the funding goes to. And of course, healthcare and science research are areas that we care about, and we have an opportunity to influence that. So Congress is tasked with appropriating, this is called power of the purse. They debate how to spend the money. They hear from their constituents and advocates, and this is why we go to the Hill, to talk to them about our priorities. And then ultimately, they come up with a spending bill. But they also come up with a report, and it's called report language. And that report language essentially gives direction to those agencies when they get the tax dollars, and it says how you should be spending the money as it relates to a given condition or an area of science or whatever it may be. The only way we get the agencies to listen about our priorities is by telling Congress how we need the agencies to focus. So this year's request for Congress was on a few different areas, those targets that I talked about earlier, but two of them were for report language, the first one being NIH. Again, we want to build on the support that they've provided to natural history, and we told Congress, ask them to convene relevant stakeholders who have been involved in funding these studies so we can create a roadmap for advancing those outcome measures and biomarkers. And Allison talked a lot about that. You've heard about the progress made in this area, but there's an opportunity to bring NIH and FDA together to help us create that roadmap, looking at what we've learned to date and trying to improve on this moving forward. So that was our request for NIH. For FDA, sort of tied into the same topic, we asked them to renew their attention, expanding on endpoints and novel biomarkers, and explore assessing things like developmental gains using more appropriate tools for data interpretation. And in this case, you might have heard of GSVs or gross square values. It's more useful for comparing a person's current performance to their own prior performance. We feel like this is a more sensitive and accurate way of looking at whether there's a treatment effect. So what we're doing here is Congress is telling those agencies, we've heard from experts and advocates about what you need to be doing. It's one mechanism we can use to ensure that they understand our priorities at the end of the day. So that was the second ask. Our third ask involves this really interesting program at the Department of Defense. And this started in 1992. The defense budget is very big. And they created a program to fund medical research, and it came about actually from service members who had loved ones and service members themselves suffering from breast cancer, and then it's actually expanded into other areas of research. But it's not easy to get on the list, but their funding allows our researchers in the AS community to tap into this money, right? We want to leverage as much money out there as possible, not just have to fund everything ourselves, which for the most part this community has been doing. So we had a lot of success with this in Duchenne, so in my past life, so we wanted to see what we can do here. It's a huge pot of money of $370 million in the last fiscal year, all dedicated to research, but it only includes a small list of conditions. So we had to advocate to be on that list. And here's just a look at, if you can see that, a range of therapeutic areas and conditions that they are currently funding. And we saw this in Rett syndrome. Rett syndrome's researchers were able to get a $13 million grant for for a multi-site clinical trial. So ask number 3, our advocates had to deliver all these in their meetings. This one was to include Angelman to be an eligible condition for this peer-reviewed medical research program. And Allison talked a little bit about the results, but I'm just going to reiterate. Well, first tell you that I've been doing this for a long time, and it's not easy in your first year to get success. We were hoping for 1 or 2 asks, and it really was the advocates at the end of the day that did the heavy lifting, told their stories, and really impacted those who represent them. After 125 meetings on the Hill, we submitted requests to all the offices, and right now, as it stands, our request made it into the final pieces of legislation, which is remarkable. Absolutely, and it's because of you all. Hopefully this, will tell you the power of advocacy and telling your story, and hopefully more might be interested in participating. So right now, while we're in the draft language, this was a huge success. The process has to finish, but we really do, we've made it over the biggest hurdle, and the deadline is December 20th. We never want to say it's completely done until we know it's done, but we suspect that a package will be put together which will include this language. So we're very proud of the advocates for doing this. And we're going back next year. We're going to go back every year. We have to. If you don't, these legislators will move on, and other groups, understandably, will come in. So we want Angelman syndrome on the lips of legislators every year, understanding your needs, and you telling your story is all we're asking you to do. We're not asking you to be experts in policy and legislation. We help you along the way. So more to come on that, and registration will open soon. So I'm going to now transition to regulatory advocacy. Obviously, a lot of progress in the space. You're going to hear more about it tomorrow. But a lot has changed when it comes to caregiver participation in the regulatory process. But our goals with FDA is we want to really enhance their understanding of AS. You heard a lot about the limitations of these measures that are currently being used. We have to give them more context about what matters to you, what's meaningful in terms of minimal benefit, so they make benefit risk determinations based on what they have in front of them and the data available. And they need to understand your lived experience, your preferences for treatment, and what constitutes meaningful benefit. And there are opportunities to do this. And that includes direct engagement with the FDA, which we'll talk about in a minute, and data collection. Drug development is understood through the language of data. And they're able to incorporate even data from you through surveys. And if we ask you to do a survey, I promise you there's a reason behind it. And it allows you to lend your voice to the process. So what is on a regulator's mind when they're making a decision? Probably many want to know. So first of all, when they're weighing a new application, they have a whole array of things that they are considering and incorporating into their final decision making. And one is obviously their overall understanding. The impact of the disease on the people with AS and their families. Your perspectives about the current available or limited available treatments and unmet medical need. Understanding of the natural history of disease, which you've been hearing about. Potential benefits of the treatment that are most meaningful, and acceptability of these trade-offs between benefit and risk and uncertainty when it comes to these treatments. And all of this could be understood through data and from engaging our community, simply understanding directly from you about these areas, and you contribute to a lot of this and can contribute. And there was a game changer in 2012. I was privileged to work on this legislation, but prior to it, there was no mandate that the FDA had to incorporate the views of patients into their decision-making. Sure, there was a lot of advocacy prior to this that had an impact, but there was no way to understand, did they do it, how they did it, and was there a way for us to understand what they did incorporate into that decision-making? So this bill was landmark legislation, and it did a few things. First of all, FDA had the ability to use accelerated approval in rare disease but they really weren't using it, so this codified that. Importantly, it also mandated that the FDA take a structured and transparent approach to incorporating the views of patients and families into their decision-making, and then tell us how they did it. So what FDA did is they responded with a new initiative, and it's called Patient-Focused Drug Development, or PFDD. Acronyms are very popular in Washington. PFDD has been around since 2012. It's a program out of FDA, and there's a few tenements to this. There's the transparency piece, where they created a new public-facing framework so that we have a better idea of how they weighed all those things we talked about in their decision-making, including caregiver and patient voices. They have to make it public after an approval. And then engagement. They came up with a mechanism to actually sit down with patient communities and hear from them directly. These are PFDD meetings. So we submitted an LOI, Amanda and I, at ASF, for one of these meetings. They only do a handful of these meetings a year. Ours will be what's called externally led, and it'll be virtual. All the information can be found at angelmanadvocates.org, and we've now branded this as Hope in Action for all of our advocacy efforts. But that's going to happen on January 29th. And we'll give you more information about this soon on how you can participate. But the purpose of this is really to meet with regulators and spotlight what matters most to caregivers on behalf of those living with Angelman syndrome, and prove the understanding of the challenges and what you'd like to address with new treatments, what would be your priorities for new treatments, and to inform programs by industry and others related to FDA review. So this is a new sort of function out of the FDA to get a better understanding of all these rare diseases that they're coming up against. So, how you can get involved? We created a new joint website. ASF and FAST created a website for everything related to advocacy, and this meeting will be sort of a kickoff of that, but you can visit to learn more. Please take the pre-meeting survey. This is your chance to have your voice included. I know surveys, we have survey fatigue, I get that, but I promise you, if we put a survey out, we will share this data broadly. It's not going to be siloed. We want as many people in our ecosystem to understand how you think and feel about your lived experience and about emerging treatments, so that they, who do not live this, can make a more informed, educated choice or decision. And then please join this virtually. This is open to everybody, as is the survey. It's not just the US. You can take this if you live outside the US. It is in English. But we really do implore you to take this. November 22nd is the deadline to take it. If you started it and you saved it, you can go back and take it and finish it. But it'll ultimately go into a report that lives on FDA's website for anybody to access that's in our space, whether that's a regulator or a company, so they have a better understanding. And the report will also include what comes out of this meeting. The meeting will have family panels, it will have polling. You can take place in live polling. There'll be Q&A. So it'll be a really important day and a milestone for this community to take advantage of. So we know everyone can't do everything, but you can do something. And we try to come up with ways for you to get active in advocacy. So we did do a recording on the new website to learn more about the PFDD meeting. Please take that survey and participate in the meeting. And you can contact Amanda and I for more information. We'd love to see people at the annual fly-in and double our numbers. I will say that this is open for family members, clinicians, researchers, siblings as well. This is, if you feel comfortable with a sibling coming, I've seen such great results from siblings attend this meeting and advocate for their brother or sister. So registration will open in December, and we're going to have a hub. So on that website, there'll be the ability to do action alerts. So if you can't make it, and if your friends are like, how can I help? We're going to have a way for them to click and send a message directly to their members of Congress and say, this matters to me, And we'll have that hooked into the website, and you'll be able to share that. You probably often get, how can I help? This is something they can do in 2 minutes. And it'll send the messages that we're sending on the Hill directly to Congress. And we really do want to build a grassroots army. And then I didn't get to touch on this, but we're going to hold a webinar on state-specific advocacy, because lots of things trickle down to the states, whether that be Medicaid, whether that be services. And Amanda and I are going to hold a webinar about what we can do. And some of this is around AS awareness proclamations for IAD coming up. That opens the door to talking with legislators, and we think that there's a good strategy that could be had here. And then there is state-specific legislation that we're all impacted. And we're going to engage those legislatures about things like Medicaid. And I know we didn't touch a lot on the global piece. Ellen and I are working on how do we sync up the things that we're doing specifically with data collection, and also carve out what is the strategy that's outside of the US so that we're harmonized in all the efforts that we're doing. So finally, I just want to thank sort of this team of people that have been working on this from day one. We're not going to stop. We're going to keep going. They're going to see us every year. They're going to hear from us all the time until they are making the most informed decisions as possible for your loved ones, because they deserve nothing less. Thank you so much.
And of all of the years we've been here with FAST, it's been well over a decade. We've never had a policy plan. And it always just seemed a bit trivial as we fund research and support research. It's like, I can't even think about going to Capitol Hill. Like, who has time for that? And when Ryan comes in and just shows the power of advocacy and the power of your words, your messages, your voice to the people that represent you in our government, it just makes it so obvious that we should have been doing this for decades. So Ryan, thank you for really bringing this forward for Angelman Syndrome. Because I'm petrified to speak to the government, so I was quivering at my knees talking to these people. And so Ryan is just so cool, calm, and collected, and I could not do it. It was very hard for me, but everyone else did such a good job. It was incredible. Okay.